हाँ जी, वेलकम करते हैं तुहाडा सारिਆਂ ਦਾ नर्सिंग करियर चैनल के उत्ते। सो सारिਆਂ ਨੂੰ रिक्वेस्ट है जिन्हें भी हले तक चैनल ਨੂੰ सबसक्राइब नहीं किया प्लीज़ चैनल ਨੂੰ सबसक्राइब जरूर कर लिया करो ताकि हरेक न्यू वीडियो की अपडेट तुहाडे तक पहुँच सके। सो ਜਿਹੜੇ ਅੱਜ ਆਪਾਂ क्वेश्चन आंसर MCQ ਇਹ करना है, ये GMCH का जो एग्ज़ाम होना 28 अगस्त ਨੂੰ उसके लिए काफ़ी इंपॉर्टेंट ने। वैसे तो सारे क्वेश्चन ने ਜਿਹੜੇ ਇਹ सारे एग्ज़ाम ਲਈ काफ़ी इंपॉर्टेंट ने, बट ਆਪਾਂ रोज़ एक दो वीडियोज़ अपलोड करिया करांगे चैनल के उत्ते। GMCH का एग्ज़ाम काफ़ी नेड़े आ रहा, 28 अगस्त को एग्ज़ाम है। सो फर्स्ट क्वेश्चन हैगा, a 75 years old unconscious patient bring in emergency. The patient had CT scan report and CSF examination is normal, but the patient have diagnosis of left lung pneumonia. In this clinical situation, which of the following principle is highlights? So options ne, CSF is normal in unconscious patient. If CT of head is normal, then CSF will also normal. C, unconscious is common in pneumonia. D, presentation of disease is typical in elderly. So the right answer is unconscious is common in pneumonia. So option C is the right answer. Next, ਇਹ ਜਿਹੜੇ ਕੁਐਸਚਨਸ ਨੇ, ਇਹ ਜਿਹੜਾ GMCH ਦਾ ਐਗਜ਼ਾਮ ਹੋਇਆ ਸੀ 1-2 ਸਾਲ ਪਹਿਲਾਂ, ਉਸ ਦੇ ਵਿੱਚ ਇਹ ਆਏ ਸੀ। ਸੋ ਸਾਰੇ ਕੁਐਸਚਨਸ ਐਂਡ ਤੱਕ ਜ਼ਰੂਰ ਦੇਖਿਓ। ਆਪਾਂ ਜਿਹੜੇ ਪ੍ਰੀਵੀਅਸ ਐਗਜ਼ਾਮ ਹੋਇਆ ਹੁੰਦਾ ਲਾਈਕ ਰਿਲੇਟਡ, ਜਿੱਦਾਂ ਕਿ GMCH ਦਾ ਹੋਇਆ ਵਾ, ਪ੍ਰੀਵੀਅਸ ਐਗਜ਼ਾਮ ਹੋਏ ਨੇ, ਉਹਨਾਂ ਵਿੱਚੋਂ ਹੀ ਕੁਐਸਚਨਸ ਦੀ ਪ੍ਰੈਪਰੇਸ਼ਨ ਕਰਵਾਵਾਂਗੇ। ਸੋ ਦਾ ਸਕਸ਼ਨ ਪ੍ਰੈਸ਼ਰ ਫॉर ਪਰਫਾਰਮਿੰਗ ਨੇਜ਼ੋਫ੍ਰੈਂजियल ਸਕਸ਼ਨਿੰਗ ਥਰੂ ਅ ਵਾਲ ਬੇਸਡ ਸਕਸ਼ਨ unit in an adult patient should be adjusted to 100 to 100 mm of Hg, 140 to 150 mm of Hg, 60 to 80 mm of Hg, 40 to 50 mm of Hg. So the right answer is suction pressure for performing nasopharyngeal suctioning is a 100 to 120 mm of Hg. So option A is the correct answer. Next, move to the third question. The method of case documentation in nursing that use data, action and response in narrative is called focus charting, case management model, problem oriented medical record, charting by protocol. So method of case documentation in nursing that use data, action and response in narrative is called focus charting. Option A is the right answer. Next, fourth, which of the statement is true about auscultation of the chest? Bronchi are common over a pleural effusion. Bronchi are characteristics of heart failure. Crepitations are characterized of pleural effusion. Crepitation are common in heart failure. So auscultation of the chest, which statement is true? It's a crepitation are common in heart failure. So option D is the right answer. Question number 5th. A patient is admitted with acute myocardial infarction on 20th June at 8 am. His condition improved on 22nd June and he is discharged on 25th June. So the discharge planning begins of 25th June. This is very easy question. Question 5th the answer हैगा option D. Next, 6th, which of the following nursing outcome statement is correctly written? Tell the relatives of the patient he is critically. B, in the next 24 hours the patient fluid intake will total 1000 ml. Patient can drink 2000 ml water if feel thirsty. Last is the patient must learn how to administer insulin. So nursing outcome statement is correctly written is, in the next 24 hours the patient fluid intake with total 1000 ml. Option B. 7th, Mrs. Geeta is caring for her 19-year-old mother-in-law. So at home visit the nurse observed that Geeta is having symptom of caregiver stress. Her plan will be to suggest shifting her mother-in-law to hospital, refer Mrs. Geeta to a psychiatric, give Mrs. Geeta a sedative, plan respite care for Mrs. Geeta. So option D, plan respite care for Mrs. Geeta. Option D. Next, 8. One of the following is not included in standard precaution in healthcare settings. Wearing a N95 mask, performing hand hygiene, avoiding recapping of used needles, practicing proper cough etiquette. So the right answer is precautions in healthcare settings are avoiding recapping of used needles. Option C. Next, 9th, clubbing of the nails finding is found in which of the following disease condition? Vitamin B12 deficiency, iron deficiency anemia, cyanotic heart disease, rheumatic heart disease. So option C, cyanotic heart disease. So clubbing of the nails finding in the cyanotic heart disease condition. Option C. Next, 10th, the uterine fundus height of a pregnant patient is at level of umbilicus or pregnancy is about 10 to 12 weeks, 14 to 16 weeks, 20 to 24 weeks, 30 to 32 weeks. So the right answer is 20 to 24 weeks. Option C. 11th, a patient total temperature is 37 degrees Celsius, then which of the following statement will true? Rectal temperature will be 37.5 degrees Celsius. Rectal temperature will be 36.5 degrees Celsius. Auxiliary temperature will be 37 degrees Celsius and auxiliary temperature will be 38 degrees Celsius. So patient oral temperature is 37 degrees Celsius, then which of the following statement will true? It's a rectal temperature will be 37.5 degrees Celsius. Option A. 12th, the normal score possible in Glasgow Coma scale is 1, 2, 3, 5. So normal score possible on the Glasgow Coma scale is 3. Option C is the right answer. Next, 13th, the main focus of the healthcare team in a rehabilitation program conducted in community is on patient functional disabilities, underlying disease that led to disability, patient functional abilities, risk factor that predisposed to the disability. So the right answer is patient functional abilities. Option C. Next, last question is, a terminally ill cancer patient has lapsed into unconscious. After discussion with the relatives, the physician withdrew all medication. The patient dies on the next day. This process is a assisted suicide, genocide, terminal wearing, passive euthanasia. So terminally cancer patient has lapsed into unconscious. After discussion with relative, physician withdrew all medication, but patient die on the next day. This is a passive euthanasia. Option D is the right answer. ਸੋ ਇਹ ਕੁਐਸਚਨ ਸੀ ਅੱਜ 14 ਜਿਹੜੇ ਆਪਾਂ ਵੀਡੀਓ ਦੇ ਵਿੱਚ ਕੀਤੇ, ਜਿਹੜੇ ਕਾਫੀ ਜ਼ਿਆਦਾ ਇੰਪੋਰਟੈਂਟਸ ਨੇ, ਧਿਆਨ ਨਾਲ ਇਹਨਾਂ ਦੇ ਆਨਸਰਸ ਚੈੱਕ ਕਰ ਲੈਣਾ। ਸੋ ਕਾਫੀ ਵਾਰ ਇਹ GMCH ਦੇ ਐਗਜ਼ਾਮ ਦੇ ਵਿੱਚ ਰਿਪੀਟ ਹੋਏ ਨੇ। ਮਿਲਦੇ ਆਪਾਂ ਨੈਕਸਟ ਇੰਪੋਰਟੈਂਟ ਕੁਐਸਚਨਸ ਦੇ ਨਾਲ।